Hello and welcome. Today's webinar is Transportation Resources and Behaviors Among Older Immigrants and Migrants. My name is Lacey Friedley. I am the Communications Coordinator at Portland State University's Transportation Research and Education Center. TREC leads the National Institute for Transportation and Communities, a university transportation center funded by the U.S. Department of Transportation. NITC consortium members, in addition to PSU, are the University of Utah, University of Oregon, University of Arizona, University of Texas at Arlington, and the Oregon Institute of Technology. NITC's research priority is improving mobility of people and goods to build strong communities. Our presenters today are Rebecca Mauldin, Stephen Mattingly, and Rupal Parekh of the University of Texas at Arlington. Rebecca Mauldin studies social connectedness. She focuses on the social relationships of older adults, the factors that support them forming and maintaining positive relationships, and the ways in which their relationships affect their health, well-being, and access to vital resources and information. In addition, she uses social network analysis to investigate human and organizational networks and their role in contributing to individual and community well-being. Dr. Mattingly joined the University of Texas at Arlington in September 2002. Prior to joining UTA, he served on the faculty at the University of Alaska Fairbanks for 2.5 years, and also served as a lecturer at the University of Southern California. While at UAF, Dr. Mattingly helped found the FAA Air Transportation Centers of Excellence Program, Center for General Aviation Research. Rupal Parekh is an assistant professor of social work at the University of Connecticut. She has over a decade of professional and practical experience working with diverse older adult populations across the continuum of care. Her primary research aim is to improve outcomes for late life immigrants, with particular attention to the role of the built environment on social isolation. Her research advocates for the development of culturally grounded assessment tools, evidence-based practices, and national and state legislation to address the needs of older adults at the intersection of social isolation, multiple health issues, and structural and social barriers. Before diving into the presentation, I'd like to let you know about another upcoming NITC webinar. On July 25th, Yizhao Yang and Rebecca Lewis of the University of Oregon will share research on sustaining multimodal choices, examining travel behavior for non-work trips beyond COVID-19. Today's presentation will be about 40 minutes long, then we will have 15 minutes to answer your questions. During the presentation, please submit your questions via the Zoom Q&A. After the webinar, you will receive an email with a link to the video recording and presentation slides. If you are tracking professional development hours, this webinar is eligible for 1 hour of continuing education credit. A certificate of completion will be posted on the event page within 24 hours after the webinar ends. And with that, I will turn it over to our presenters.
Hello, everyone. I'd like to extend a warm welcome to you all. Thank you so much, Lacey, for the lovely introductions. On behalf of my co-PIs, Dr. Rupal Parekh and Stephen Mattingly, in addition to welcoming you here, I'd also like to say a big thank you to both Lacey and Becca from the National Institutes for Transportation and Communities for organizing this webinar today.
We'd also like to gratefully acknowledge NITC, the University of Texas at Arlington, and the University of Connecticut for funding this research. In addition, we would like to thank our research participants, research sites, community partners, and the members of our research team, which include many students from undergraduate to the doctoral level. Today, we'll be presenting the background and theoretical foundations of our study. We will introduce 2 related studies. The first study was conducted with older Vietnamese immigrants. We'll present the aims and methods, phase 1 results, and phase 2 analysis and results. We will also present our analysis and results of study 2, conducted with Hispanic Senior Center members in Hartford, Connecticut. We will discuss our conclusions and key takeaway and allow time for discussion and Q&A. Nearly 4.6 million immigrants aged 65 and older live in the United States, and this population is expected to more than triple in size by 2050. Currently, there is a lack of culturally appropriate transportation solutions for older immigrants. This creates disparities in access to services for older immigrant populations, increasing their risk of social isolation and reduced physical and mental health. A growing number of older immigrants live in low-density urban environments, which are characterized by high automobile dependency and limited public transportation. In these environments, older immigrants are likely to depend on others to provide private transportation. Negative aspects of this reliance on others are that private transportation providers may be at risk for caregiver burden and stress, and older immigrants may lack transportation to social and health opportunities. The capabilities approach provides this study of an understanding of how transportation is a key component of capability. The key idea of the capabilities approach is that social arrangements, such as transportation systems, should aim to expand people's capabilities, their freedom to promote or achieve valuable beings and doings. The capabilities approach combines the concepts of freedom, welfare, and equity, and focuses on what individuals are capable of achieving. We conceive activity spaces as a manifestation of capabilities into actual movement spaces, which indicates ability to access resources and space. As mentioned earlier, we will present two related studies. The first study is a survey of older Vietnamese immigrants and their ride providers in the Dallas-Fort Worth metroplex. This study has two phases. The second study is a social network analysis of a senior center serving predominantly Puerto Rican older adults in Hartford, Connecticut.
So the first phase of our study, as Dr. Parekh just mentioned, studied the transportation among older Vietnamese immigrants in the Dallas-Fort Worth metroplex. From here on out, I'll probably just call it DFW. This was actually a pretty sprawling study with 7 aims. And in our annual report, our final report, which is on the NITC website, each of these aims is addressed in that report. So we encourage you to check out the report. There's also a project brief if you're interested in learning more than what we're presenting today. But for today's presentation, we will share findings from 2 aims. The first is to describe the transportation, resources, and behavior of older Vietnamese immigrants in the DFW metroplex. And the second aim we'll be discussing is describing the effects of lack of transportation on key important routine activities, and we'll be calling this unmet travel needs. Sorry about that, Steve.
All right. So for study 1, our phase 2 aims are focused around a variety of topics, including looking at transportation resources and behavior, looking at types and frequency of rides provided, and describing the impacts of providing the rides. Today, though, we're going to be focusing primarily on looking at the provision of rides and looking at regular rides. So for both of these cases, we're going to be looking at activity spaces. I'm going to describe those in more detail later on, but that's going to be our focus of metric that we're going to be using to assess this. And we're using these activity spaces to help us be able to evaluate geospatial burden. And we're hoping that this can serve as a way to try to better contextualize the challenges that caregivers may be experiencing as they try to care for aging parents, especially in the aging society that we have right now here in the United States.
So for this study in the DFW Metroplex, our inclusion criteria for phase 1, which was the older adults, is first of all to be at least 65 years old, to be Vietnamese or Vietnamese American, live or conduct routine activities in DFW, and the ability to communicate in Vietnamese or English. We used convenience sampling, which was first informed by local leaders in the Vietnamese communities. And this included just a wide swath of things, from posting flyers at several sites to running ads in a weekly Vietnamese magazine. We worked with many community-based agencies that were serving older Vietnamese adults in the area. For participants, we offered a $20 Walmart gift card as an incentive for completing the questionnaire. And in all, we enrolled 95 eligible participants. In the second phase of the study, the plan was to use results from the first phase, where we learned about ride providers and recruit ride providers into a survey research study. So we recruited adults who lived or provided rides to an older Vietnamese person in DFW. Initially, as I mentioned, it was snowball sampling, and we were providing $10 Walmart gift card as an incentive. But I would say we were conducting this in the middle of the pandemic. So later in the recruitment period, to increase our sample size, we added convenience sampling, where we didn't require pairing a ride provider to someone that we had already collected data from in the first phase, and we increased our incentive to $20. And at that point, we finished our enrollment with 20 participants, 11 of whom we had paired with an older adult from phase 1. As I mentioned, it was in the middle of the pandemic. We were collecting data from July of 2020 to January of 2021. All of the data collection was done over the telephone with interviewer administered questionnaires. We used Qualtrics survey software, and it had a Google Maps integration feature for collecting the geospatial location data. The interviews on average with the older adults were 30 or 40 minutes. All but one of these were conducted in Vietnamese. For phase 2, the interviews lasted about 20 minutes, and a little over half were conducted in Vietnamese. On the questionnaires for both phases, we asked several questions about transportation, routine activities, and for older adults, we asked about unmet travel needs. First, automobile ownership was assessed with one item, which asked, do you or someone in your household own an automobile? For modes of transportation, we provided several different options from walking, driving, getting rides, public transportation, paratransit, taxis, ride sharing, and other. And respondents could select as many of these as applied to them. And then based on that answer, they also provided the frequency with which they use that mode of transportation. And there were just ordinal response options. We also recorded monthly transportation expenses.
Briefly muted, yes.
By asking approximately how much money in dollars do you spend each month on your
definitely not
transportation?
Tulsa. We'll check what.
So participants in both phases were also asked about their routine activities. And for this, we gave a list of 20 different key activities, from grocery shopping, visiting with family, religious activities, just all sorts of things. There were also other and healthcare facilities, which asked them to, list several. They had option, I think, for 3 or 4 different healthcare facilities. And we asked, which of these do you do routinely at least once a month? And they could select as many as applied. And then based on their responses, we followed up and asked how many days a month did they do that activity? And that could range from 0 to 30. And then we We also asked them to provide the most common location when they went and did that activity. So basically the Google Maps integration in Qualtrics, when the question popped up for the data collector, they actually saw a map. And just like in Google Maps, they could begin to type in a location, or they could scroll and find the location in the map just by moving it around. And then they were either able to drop a pin in the location, which recorded latitude, longitude, or if they typed the precise address, the pin would go there automatically. If the respondent didn't want to give a precise address, that wasn't a problem, and we just asked for the nearest cross streets, and then the data collector would drop the pin at that intersection. For the older adults, we were interested in unmet travel needs, so we asked them the question, in the past month, which of the following activities have you been unable to do because you did not have transportation? And then they were provided with the exact same list of 20 activities and the other that they could specify on their own for anything that they had missed because of no transportation. And then finally, for the ride providers, they were asked pretty much the exact same series of questions with activity type, frequency, and location, but they were asked about which of the following activities do you routinely go to when you give rides to? And so for the people who were paired, we were able to provide that person's name, or for the person, if they weren't paired, they had told us it earlier in the survey. So we were asking, when you give rides to this person, where are you taking them? How often are you taking them? And what type of activities are you transporting them to? So with the data we collected, we also calculated some measures that we're presenting today. And so I'll discuss 4 variables. The first was just primary mode of transportation. And in addition to just knowing what modes of transportation, we use that frequency variable, so that the most frequent mode of transportation that the person used was deemed their primary mode of transportation. We calculated transportation cost burden as being spending more than 15% of income on transportation. We looked at the impact of providing rides for ride providers, and they were given a list of 5 items. So they asked if they had incurred transportation-related expenses, if they'd missed work, if they'd missed their own healthcare appointment, if they had increased personal stress, and then there was an open-ended option where they could tell us what other impacts that they may have had. And then we combined all of those and said if they reported any of those 5 options, that they had an impact of providing ride. And last but not least, Steve's going to go over this in detail, but we also calculated the activity spaces, and this is what we used the location and frequency of the activities to create.
Okay, now I'm going to present the results on phase 1, transportation and unmet travel needs of the older Vietnamese immigrants. So our sample size, we had an N of 84. 100% of the population was born in Vietnam and primarily speaks Vietnamese at home. The average time that our sample lived in the US was 27 years. The average age, 74 years old. 64% of the sample was female, 51% married. 70% of the sample lived with others, and 57% had less than a high school education, and 80% of our sample had an income less than $1,000 each month. As you can see here, these are the modes of transportations reported by the sample. Could you click? Okay. Transportation in private automobiles was the most common mode of transportation. And as you can see, 83% of those who drove at least once a week. And 50% of those who got rides with someone else did so at least once a week. A small portion walked for transportation, and less than 5% used public transportation, paratransit, or taxi ride-sharing services. So as you can see here, transportation to healthcare was similar to overall modes of transportation, in which private automobile travel through rides with others or driving oneself were most common. Paratransit services were more common than taxi or ride sharing, but neither were particularly common. As part of our snowball sampling, we asked those who said they got rides from others to provide information about their ride providers, including primary language. Of the 36 ride providers the older adults told us about, 97% spoke Vietnamese as the primary language. This finding speaks to the importance of having a cultural fit of recipient provider. Most of the services that we see, at least with ride sharing, really focus on cultural fits with not cultural fits, but really kind of fitting folks based on age and other characteristics. We're seeing very little that focuses on making sure there's a cultural fit with the recipient and provider. So this was a real key finding for us. So almost 1/3 of the sample reported unmet travel needs in the previous month. Some of these activities included social engagement and healthcare. This is quite vital to older adults' well-being. So it's noteworthy that they are missing activities that could help them maintain health and well-being. It is possible, as Rebecca mentioned, Dr. Mauldin mentioned, that this was underreported because this would have happened outside of pandemic circumstances due to closure and social distancing.
All right, so let's move on to looking at some of the geospatial burden indicators. So what we're going to be doing is we're calculating these regular activity spaces, and we're doing all this using ArcGIS, where we're translating the latitude and longitude responses that we received in our survey to point data. And we're using that for every one of the destinations that we've identified during the month. So we have two different cases that we're looking at. We're looking at home address, and then we're looking at routine activity locations. And so in the case where we just have two geographic locations, like a home and a single activity, we'll be using the second approach. This first approach, which is a larger amount of our cases, we have two or more routine activity locations and a home, and we're creating a one standard deviation ellipse. And what we've done is we've weighted the activity space by the activity frequency, and we're using this measure that Rebecca described earlier, where we're looking at the different up to 30 days of activities at each particular location. So for home, we're weighting that as 30, and then each of the other activity locations could be as high as 30, but if they're used less frequently than daily, we'll have a lower weight on those. The ellipse contains approximately 68% of the locations that should be accessed on a routine basis by each person. For the two geographic location case, we just use a half-mile road buffer and use the shortest path between the 2 points. In all of these cases, we're really trying to focus on identifying the presence of key health, social, and household maintenance activities within the activity space and seeing which ones are lying outside of the activity space. As I said earlier, the activity space is also playing a very key role in our determination of burden. So just as a quick example of what these activity spaces look like, in case one, we see the ellipse case where we've got the home location generally located kind of near the center of the ellipse. And then we have another location contained within the ellipse and two locations that they travel to, probably not as frequently, healthcare and another location that are outside of their regular activity space. When we look at the regular activity space for case 2, we've just identified 2 locations and connected those 2 locations and drawn a buffer around. Next slide. Okay, so here, one of the things that we're also interested in looking at is the ride provision activity space. So just because older adults are engaging activities does not necessarily mean that they need their ride providers to actually provide the transportation to every single one of these activities. Some of the locations that they're going to and visiting could have other transportation options available to them to access. So here, what we've done is we've developed the regular activity space for the ride provider, and that's denoted in blue here. And then we also have denoted the ride provision space, and this is denoted in magenta. And so what we're looking at is we're looking at in the subsequent slides how these activity spaces overlap. We're going to be using that to help describe burden. Next slide. So we've developed 3 different burden indicators in this study to investigate. And our first burden indicator is just the size of the ride provision activity space. Rather straightforward, we're measuring it in square miles. And as you can imagine, as the space that you're providing rides in increases, we're hypothesizing that that creates a greater burden on ride providers. For burden indicator B, this is the percentage of the ride provision activity space that is not accessible to the ride provider. And so what I mean by that is it's the space of the rides that are, the activity space of the rides that are provided that are outside the regular activity space of the ride provider. We've got a slide coming up that'll help illustrate that a little bit more effectively. Once again, we're hypothesizing that as this percentage increases, then the burden will correspondingly increase. Burden C, we're looking at the ratio of the inaccessible ride provision activity space to the ride provider's regular activity space. And here, what we're looking at is kind of that, how much more activity space are they adding to their regular activity space? And we're hypothesizing here that as their own activity space becomes larger, the additional activity space that's added may be less burdensome. And so that's our hypothesis for burden C. Okay, so here is our example. C indicates the space where we have an overlap between the ride provider and the ride providing space. G is the area that's not part of the ride provider activity space, regular activity space, but is part of the ride provision activity space. And then S is the remaining portion of the ride provider's regular activity space. And so when we look at burden A, the magnitude of the ride provision activity space, that's just G plus C. And then for burden B, we're looking at that area C and dividing it by G plus C. And then for burden C, we're looking at G and dividing it by S plus C. Okay, so here's some of our results. For geospatial burden indicator A, we've got a wide range of ride provision activity spaces. One is very small, you know, microscopic, I would even say, with it being, you know, less than a quarter of a square mile, which I'm not so sure why that's not walkable, but it could be given the health needs of the older adult. All the way up to 279.5 square miles. And in Tarrant County, that's 30% of our county area that they're providing rides in, which is fairly significant, given potential congestion levels and other challenges that the ride provider might face. Indicator B has a mean of 50%, but ranges between 0 and 100%. So we could have virtually the entire ride provision activity space outside of the ride provider's activity space, or we could have a case where virtually the entire ride provision space is embedded within the regular space of the ride provider. And then indicator C, most of the ratios tend to be less than 1, where we've got the inaccessible space being added is much less than the ride provider's regular activity space. We do have a minority where it's greater than 1, and surprisingly, we have one that's up to 61 times as large. My supposition on understanding exactly what's happening with our data there is related to most likely a very small regular activity space for the ride provider. So now let's look at the correlations to start understanding what's happening as we look at these indicators together. And so one of the things that we definitely see is a large and significant correlation between indicators B and C. That makes sense given the fact that we're using similar components within the activity spaces to calculate these burdens. We see a moderate correlation between indicators B and A. It's not significantly statistically significant. Some of this could be driven by our sample size, but we're also not positive that they're going to have a super strong correlation at any point. We're also noting that as our geospatial burden is increasing, especially for B, we're noticing that there's a decrease in the frequency of rides provided. And this makes sense that and fits very well with our hypothesis for indicator B, that as that more and more of the activity space falls outside of their regular activity space, they're going to provide fewer rides to those within that activity for that person receiving rides. Then the last thing that we're looking at is we're looking at monthly expenses for providing rides. And here we see a similar situation where A and C, we can see a positive correlation with the expenses associated with providing rides, especially related to A, where, and this once again makes perfect sense, that as the activities, the ride providing activity space becomes larger, the expenses associated with providing those rides would increase. So it's not significant, but we do expect that trend would be one that would emerge and persist as our sample size increases. We see a negative correlation that emerges between geospatial burden indicator B and the expenses. This lines up well with the frequency correlation that we see above, where they're traveling less frequently, therefore the monthly expenses decrease. That's really the relationship that we're capturing at that point. We see a really high correlation between monthly expenses and the frequency of providing rides, as one would expect, but our small sample size still makes this insignificant. This last slide is looking at the relationship between caregivers describing impacts that they're having associated with providing rides. And so when they're reporting one or more impact, that's what we have in the second cluster. And then those ride providers that are reporting no impacts are in the first cluster. And what we're seeing is we're seeing increases in indicators A and B for those reporting impacts. And the mean jumps significantly when we're looking at the magnitude of the ride provision activity space for those that are reporting impacts. Once again, our sample size is really conspiring to impact our potential for statistical significance. There's definitely promise here for burden indicator A, really helping to capture the impacts of the ride, the potential for impact on the ride providers. Burden indicator B also increases. The difference is not necessarily that large. Same situation though, a larger sample size, and where we have the potential to illustrate the fact that burden indicator B also aligns well with potential impacts for ride providers. Burden indicator C, it gives us kind of a weird result as far as we're concerned, because we're seeing a decrease in indicator C for those that are reporting impacts. And so this may not be doing as well as a burden indicator as we initially hypothesized. And this might be an indicator that we drop in future studies for further consideration. When we look at the frequency of providing rides, we also see that the frequency of rides does not necessarily reflect the impact problem. The impact really is being driven by the geospatial component more than the frequency of rides. All of these are not statistically significant. We definitely see the need for increasing our sample size in a subsequent study to be able to understand these more clearly.
Right, so I have a very short period of time to talk about our second study, and my plan is to pretty much just fly right through these. Maybe I'll take a little bit more time than we were allocated, but I will say there's so much to go over in this material. I love talking about social networks. I'm happy to follow up with any of you offline. The slides will be posted. We are also presenting these at 2 upcoming conferences this year, and we'll be working on a publication. So this is not your only chance to hear this information. Basically, we were really interested in social relationships within a senior center for a couple of reasons. Senior centers have been a long-standing environment and setting with which to help enhance and develop relationships among older adults, because social relationships and combating loneliness is incredibly important to their well-being. So we had the opportunity to work with the Hispanic Senior Center. That was the name of the senior center in Hartford, Connecticut. And we looked right after COVID-19, knowing that people who were coming back to the senior center had likely been spending time relegated in their homes. And there was so much of social isolation and loneliness during the pandemic that we really wanted to look at what happened with the relationships in relationship or in association with transportation related factors once the people return to the senior center. So very briefly, and I'm going to make this really brief, right after this center reopened, which was in August of 2021, we came in and collected data from September through December 2021. And we basically tried to recruit everyone into the study who was a regular member at that point in time. And we recruited 93%. For this particular analysis, one of the criteria was having a companionship, having reported at least one companionship among the members. We did, as a result, exclude some people who reported no companionships, but we did an analysis and there were no statistically significant differences on our key variables or on demographics for the two different groups. We included the same measures as we did in study one, but this time we also presented them with a roster with photographs and names of the other members and asked for each one of those people, does this person provide, and I'm going to say you, but the phrase was, this person provides me with good company and companionship, includes them in things that they were doing, or does social or recreational activities with them. Most of our sample was female with low education, low income. 40% had an automobile in the household. Only 20% drove as a primary transportation mode. We had a lot of people getting rides and a lot of people walking or using public transportation among this group. Four people, so 13% reported having an unmet travel need, so they were unable to attend the senior center in the previous month because they didn't have transportation to it. And about a quarter, a little over a quarter, were transportation cost burdened. The sample was about 75 years old on average. The IADLs is a level, I'm going to just really skip this, but it's about physical limitations. And what this number is indicating to us is that we have people who have a moderate degree of potential limitations to their independence of living alone and acting physically independent. On average, people were attending the senior center 17 days per month. So if you think about not coming on the weekends, they were really frequent flyers. Here is a visualization of the network. So a couple of things I want to point out to you, the shapes, so you'll see circles and triangles, those are people, and the lines indicate that the people had a companionship tie between them. The larger circle, the larger shapes are people who were transportation cost burdened. And from my eye, when I look at those larger shapes, they tend to be a little bit on the outside of the network. You'll see kind of looking at this network, you can just immediately see that there's one big major large component in the middle with then two outside groups with 2 or 3 people in them who are companions, but not linked into the other. The purple means that there's a car in the household, and the black means that there's no car in the household. To my eye, it looks a little bit like people with household automobile ownership are more likely to be in the center, and we see a little bit more on the black symbols on the outside of the network. And last but not least, the shape. The circles are the drivers. And no, I'm sorry, the circles are not driving and the triangles are drivers. We unexpectedly, when I looked at this, I was really expecting drivers to be more central. And you can see like in that core in the middle of the one major component, that core group that everybody's connected with each other, none of those are primary drivers. And so we can tell a bit from looking at a static network like this, but the main limitation to this is that the brain can really only explore or try to make sense of one of these categories at a time. Once you start looking at it from a multiple variable situation, it's really hard to make sense of it. And it also doesn't like give you information about social structures. So are we seeing patterns like people tend to be friends of their friends' friends, and therefore some of the structure that we're seeing about transportation might actually be more related to the social phenomenon than they are to transportation. So to deal with that, we use a model called exponential random graph model. It's like a logistic regression, except it accounts for dependency among the social ties. Our outcome variable was the likelihood of a companionship relationship, and after controlling for frequency of attending the center, demographics, and network structure, we looked at 4 transportation variables. Were they driving as a primary mode of transportation? And we thought this would be positively associated. Did they have a household automobile? Again, we thought this would be positively associated with companionships. Were they transportation cost burdened? And had they missed going to the senior center in the past month? And those last 2 we thought would be negatively associated. And here's our results. For the most part, our hypotheses were confirmed with the exception of primary driving. And in that case, people who were primary drivers were less likely to have companionships in the senior center. We have thought about this, and we think maybe it's because, and going back to the capabilities approach, providing freedom for choices, that maybe it's because the ability to drive gives people opportunities to have social engagement outside the senior center, have a lot more freedom with where they're establishing and cultivating their relationships. That said, that's what we're thinking. I have all sorts of ideas about the rest of these findings. I will say transportation cost burden was non-significant, and it likely is related somewhat to driving being pretty much a significant driver of whether or not people were transportation cost burdened. So I know I flew through that, but I see I'm already 5 minutes over. So I'm just going to stop and we talk about our takeaways. I'm happy to go back to this and dive into a little bit more detail for those of you who are interested during the discussion section. Our main takeaways, I know this is tons that we have thrown at you, but truly by the nature of some of our reconceiving this research during COVID, but also because we had the opportunity to get a diversity grant from NITC and to conduct the study in the senior center in Hartford, we have a lot to report. So our main takeaways are that, yes, this is exploratory research, and yes, we have very small samples, but we still think that there's some really promising indications for future inquiry. Second is that we think it highlights that older immigrants do have unique transportation patterns and needs. And to really circle back to what Rupal was saying, there is that match between ride providers and ride recipients in terms of language. And so it really points to the potential need for culturally appropriate ride providers. We think that taking a look at this geospatial transportation burden also shows promise and could be an important way, once additional research is done, to understand the capacity of ride providers to support older adults. And last but not least, transportation does matter in the relationships that people are forming in the senior center context. So we think about interventions for older adults to combat social isolation and loneliness. Transportation is an important factor to consider. So that is our presentation. And I'm looking forward to answering your questions, hearing your comments, and having a discussion regarding this.
Right, thanks very much for a great presentation. We do have a lot of questions in the Q&A. We'll do our best to get to as many of them as we can. The first is, what are considered culturally appropriate methods of transportation, and how are they different from existing modalities?
Rupal, do you want to take that one?
Well, I think one of the things that Rebecca just mentioned is critically important. Culturally appropriate definitely would include making sure that there's that information is translated in various languages. I think also culturally appropriate would also include that the transportation access in neighborhoods where these populations may reside. So having access, having transportation services that are accessible. I think is part of being culturally appropriate. Also having right providers, as we mentioned a few times, that can converse with the recipients in their native language. So not just having information, the paper or that type of information that's translated in those languages, but actually having people that can speak those languages that are providing transportation to these individuals. Those are just a few that I'm thinking of on top of my head. There are plenty of more ways in which we can provide culturally competent services, transportation services. And again, depending on if it's paratransit, if it's ride sharing services, that may look really different. So there's lots to think about here, but thank you for that question. And please, Rebecca, Steve, if you want to.
You know, the only thing I would like to say as a follow-up is that in the Vietnamese community, family ties and responsibility and respect for older people is a really important cultural value. And so what we're seeing is that a lot of the ride providers are family. And even when people do have knowledge of public transportation or knowledge of paratransit, they're not using it. And we didn't do a mixed method, so we don't have qualitative data, but anecdotally, we did hear from people who were like, no, of course it's my daughter, of course it's my son who provides these rides for me. So I think even if we're looking at, you know, paratransit where we just have people who are able to speak the language, that might not be enough. We had a community partner who was actually a transportation expert who was Vietnamese and had lived in Arlington for many, many years. And he said he thinks this points to potential policy of providing family subsidies to help with, because if paratransit isn't getting people where they need to go, if public transportation isn't needing to get people where they need to go, maybe there's another way to spend public dollars to support mobility for older adults.
That's a great point. Thank you. Next question is, how do the older immigrants know, for example, the affordable transportation information? Like, how do you communicate with them? How do you know their needs? And also, like, what are the strategies to help them understand and participate in the program if they're not comfortable using the webinar or using technology?
I couldn't understand the question. I may need to look at it in the chat.
Oh, sorry, it was a longer question. It's asking, like, how did you communicate with the older immigrants and how did you know their needs?
Yes, okay. I will take that because I think, so I was leading the study in Dallas-Fort Worth and Dr. Parekh was leading the study in Hartford. So we may have different responses. But what we found is that many of our participants were connected. We have two Vietnamese, very strong Vietnamese senior centers in the area. So many of them were connected with that senior center, and at the senior center, they offered social services there. We also found that many of them were geographically located in similar areas. So, for example, a subsidized apartment complex near an Asian food market was a common place. And so I think some of it is finding people where they are and utilizing pre-existing structures in which to reach out and meet. One of our advisory board members was for Catholic on the board of, no, he was an employee at Catholic Charities, involved in providing transportation and involved in working with older immigrants. And he was a little bit flummoxed with this question himself. So even people in the community are finding that it is also difficult to reach out and find people. And so I think it really speaks to, I mean, Dr. Parekh and I are both social workers. And so we can toot our own horns all day long. I think it speaks to the need for knowledgeable social workers, knowledgeable community health workers, people who understand both transportation and social services and the community to really be working hard, because this is a very difficult conundrum, in my opinion. It's not something that's easy to resolve.
Oh,
Yeah, and I just want to second that. We saw the same sort of pattern at the Hispanic Senior Center in Hartford. They did have a amazing senior center director that really served as a social worker and provided them with information. In fact, the Paris transit has changed in the last year there in Hartford. So she really would invite folks into the senior center that would help provide educational seminars. But as you know, Rebecca said, I think this is critically important, is that, you know, this is one person and she is doing a tremendous amount of work, but we need more folks out there that are doing this work, that are on the ground, and folks that are not showing up to the senior center, because we're seeing that as, you know, an issue since COVID-19. How do we get to those folks and how do we get the information? So I think about home and community-based workers, social workers. I was one of them for 15 years. So, you know, really going out to the community and educating people about the different services that are there and how they can access them. And also how they can be advocates for themselves, because I think that's critically important in this space as well. And I see that a lot, at least I saw that a lot in the Hispanic Senior Center. People really did want to play that role and were looking for opportunities to play that role.
Great, thank you. Next question, how did you decide to use a 15% threshold as a transportation cost burden?
I can answer that one, but I'm going to let Steve take it because he's probably got the citation on the top of his mind better than I do.
Oh, we use the 15% because I don't remember the exact citation, but it is a widely cited percentage that we can use to allocate for transportation costs. You can also see it framed as housing plus transportation, where you'd have 30% plus for housing plus 15%, or total of 45% intended to be allocated to the combination of housing plus transportation. And this is to account for the potential for people to locate themselves where they could reduce their housing costs, but then take on greater transportation costs, or correspondingly increase their housing costs, then take on smaller transportation costs. So it's the expectation, and this works well for typically works fairly well for middle income, median income type households. But as you start to creep down into very low income households, the 15% is not a very good measure of household expenses. In order to meet your needs, you're essentially forced into a transportation cost burden situation where you would always be exceeding 15% of your budget, because their transportation accounts for so much of their income to meet their basic needs. And so that's where we see burden creep in almost uniformly is for lower income households.
Yeah. I think we may have time for one more question. It is almost time to end, but in the chat, I just put a link to the project webpage where you can find email addresses for all three of the researchers if you would like to follow up. And just really quickly, maybe if we can briefly answer this one, what conclusions did you draw from lack of use of public transit options?
I will start on that one.
Sorry, so I know it's not much time and it's probably a complicated question to answer.
It is and it isn't. I mean, in some ways, Dallas-Fort Worth, as we mentioned, is a low density automobile dependent region, and people drive their cars here. It is difficult. Many people in a suburb may have, especially older adults, maybe their healthcare is in Dallas, but they live in one of the suburbs, or their healthcare is in Fort Worth. And the public transportation across the metroplex is not super well integrated unless you basically want to take a train from Dallas to Fort Worth type of thing. So I think part of it is the lack of really good public transportation options, even for people who are living in the city of Fort Worth or in the city of Dallas. Sorry, transportation planners. But I think many people would find that transportation is not easy in those, or even in the urban areas. I think some of it is that there's just, I mean, we didn't report on the amount of knowledge, but the amount of knowledge about transit in the study one with the older Vietnamese adults is remarkably low, remarkably low. Women do know a little bit more about it than men, and we think maybe it's because they're not as likely to be drivers, so they're looking for these options on how to get to where they need to go. But some of it is knowledge, but it also, like we discussed with the guy from our advisor from Catholic Charities, there is just a barrier to using it, which is either a preferential barrier or cultural barrier or knowledge, but there are definitely barriers that are out there that people are not using what's available.
And I'd say the same in the Hartford study. Also, we think of it as more of an urban, but we're looking at greater Hartford. So that includes, many low density communities. But also, what we're seeing is that although there is transportation available, it's difficult. It's difficult to get to. A bus stop might be, several blocks away, and health, concerns of the population might be a real barrier to actually, getting on a bus. Also, there is some paratransit that has been provided to the senior center. So that's another reason that, maybe they're not using other forms of public transportation. But mostly it's, what we're seeing is that, it's a real barrier. Although it is more available than it is in the DFW Metroplex, it's still not as accessible as it should be for this population.
Great. Well, thanks very much for a great presentation, you guys. And I will end the webinar now. And enjoy the rest of your day. Thanks very much.
Thank you.